For the shoulder views, we're gonna have a cassette of 10 by 12 and an SID of 70 inches. For A to P shoulder external rotation, we're gonna ask the patient to turn the palms hand forward supine and then abduct their arm slightly so that the line through the epicondyle is parallel to the film planes. Use a small angle position sponge to keep the arm immobilized, and the center ray will be perpendicular to the coracoid process through the center of the film. For A to P internal rotation shoulder, we're gonna ask the patient to stand up upright, internally rotate the arm, and rest the back of the hand on the leg. A line through the epicondyle will be perpendicular to the film plane, and the center ray will be perpendicular to the coracoid process through the center of the film. For AP shoulder baby arm or abduction, we're gonna ask the patient to raise their arm in an out position, and the center ray will be the coracoid process. For shoulder neutral rotation, we're gonna ask the patient to rest their palms against their thigh, and this position will place the epicondyle humerus at 45-degree angle to the plane of the film. The center ray will be perpendicular to the coracoid process through the center of the film. For the A to P Xray view, we're gonna place the patient 30 degrees angle oblique position in order to accomplish to visualize the lateral glenohumeral joint. We use the body of the scapula of the patient in rotation obliquely following the curvature of the posterior rib, and the center ray will be perpendicular to the coracoid process. For scapular Y for shoulder, we're gonna have a P2A 60-degree body rotation. We're gonna ask the patient to erect, facing the upright detector, rotate in an anterior oblique position so the anterior portion of the shoulder is touching the upright detector. The hand is placed on the patient abdomen with the arm flexed, and the center ray will be the humeral head. For lateral shoulder, we're gonna ask the patient to abduct their arm in top of their head and toward to the film receptor, and we're gonna have a center ray of the humeral head. For the scapula views, we're gonna have a 10 by 12 cassette and an SID of 17 inches. For A to P scapula, we're gonna ask the patient to put their back in against the image receptor. Scapula of the affected side is at the center of the image receptor. Affected side arm is abducted with the arm in supination. This action will pull the scapula away from the ribs. Then the patient is slightly rotated 5 degrees. Then the body of the scapula is lying parallel with the image receptor, and the center ray is 5 cm inferior to the coracoid process. For the lateral scapula, we're gonna have the patient straight up with the humeral carefully placed straight up across the chest, hand or opposite shoulder, or behind their back, depending which side the patient have pain, complaint, or capability of move. The humerus of the scapular body of the resonance of the Xray image receptor, and the center ray will be perpendicular to the scapula. For the clavicle views, we're gonna have a SID of 17 inches and a cassette of 10 by 12. P2A clavicle, we're gonna ask the patient to stand and put the back on the image receptor, and we're gonna put a center ray at the middle of the clavicle through the center ray of the image receptor. For A to P clavicle semi-axial, the patient is erect, A to P positioning the same as the AP projection. The central ray will be at the clavicle in angle of between 50 to 20 degrees cephalad. For the AC joint with weight, we're gonna move the patient so that the other AC joint is centered to the field of the make exposure with and without weight. The central ray will be perpendicular to the body at the level of AC joint at 40 inches SID and centered to the field.